Elizabeth Leach. I've been involved as a lecturer in the mental health practice program at Griffith Uni for a couple of years. I came from a background of working in mental health service reform and policy, service development in a public health service, and have had a long involvement in actually clinical mental health services. 7052 HSV, Comorbidity and Mental Health, is about looking at people with comorbid mental illness and other problems. So we recognise that people who are in contact with mental health services often have a whole host of issues in their lives, not just a mental illness. So they may be using substances like alcohol and other drugs, or they may have physical illnesses or intellectual cognitive disability that complicate their presentation to the service. So in this course we look at how do you as a service provider identify and respond to all those different needs in a person's life. So we do look at some of the theory around particularly substance use and mental illness and how those two conditions co-occur and relate to each other, but we also take a very practical view about what is it that the practitioner has to do to help people with those issues in their lives. In this course we do a series of practical tasks that are looking at analysing case studies. So for any particular area of comorbidity we get students to think about how they could respond to a particular case. Throughout the semester we do have a strong focus on communication skills. So we get students to work together on their assignments and to review each other's work. This is really important in developing the communication skills that they will need in working in team environments in the mental health sector, and we think it's really important too in improving the outcomes that will be achieved for the consumers in those services.